Hi, everyone. My name is Nico Murillo, and I'm the chair of Texans for Safe Access. And I'm so excited to have Dr. Olga Obie with us today to talk about multiple sclerosis and how medical cannabis may help. So I want to read Dr. Olga's bio. Dr. Olga is a native Houstonian, board-certified emergency physician, board-certified eligible lifestyle medicine coach, practicing cannabinologist, and a Texas state registered compassionate use doctor. She works with patients across the United States to refine their health with cutting-edge lifestyle changes and a tincture of cannabis in legal states. Dr. Olga believes cannabis is an important and promising medical plant and enjoys educating anyone who will listen. Dr. Olga is on TSA's board as our physician educator and leads us in medical outreach and education. So I want to bring on Dr. Olga. Let me hide some of these banners for us. There we go. And so, hi, Dr. Olga, how are you doing?
Hey, everybody. I'm fine. Thank you, Nico.
Yeah, well, thank you so much for joining us. So I'm going to jump right to it. This is an exciting topic, and I'm glad to see that this condition is a qualifying condition under our teacups. So, Dr. Olga, can you tell us what is MS?
MS is short term for multiple sclerosis, and it is an autoimmune disease. So what that means is that an individual's own immune system attacks a part of their body. And in this case, it attacks the protective covering of your nerve. The best way I explain it to patients is a nerve is just like a wire. If you can think of a wire that has like that black rubber covering. The wire itself is meant to conduct electricity, and the wire is meant to enhance or optimize that conduction. And so the signal that you send from point A to point B gets there better because of the covering. In MS, that covering is the part that is attacked by the immune system. And eventually that covering starts to wither away, and all you're left with is the unprotected nerve. And it has a very difficult time conducting a signal from point A to point B. Signals are important for things like thinking, moving, feeling pain or not feeling pain, etc. So you can imagine in multiple sclerosis, patients suffer with a lot of neurodegenerative disorders because the protective covering is being attacked by their immune systems.
Oh, wow. Thank you for that. And so what are the main types of MS?
There are 4 categorized types of MS. The most common is called relapsing remitting MS or RRMS. Then there's primary progressive MS, secondary progressive MS, and progressive relapsing MS. The next most common one is, I think, PPMS, which is the primary progressive MS. All of them are progressive conditions in multiple sclerosis.
Okay. And then, so what are the current medications for MS?
For the most part, we start with medications that will help the immune system to kind of chill out. And those are antibody-mediated medications. So most MS patients will start on things like interferon beta or some similar medication that is FDA approved. Most of the medications are primarily for RRMS, which is the most common type of MS. There are a few FDA-approved MS drugs for PPMS. But the most common MS drugs are medications for symptoms and for inflammation. So you'll see a lot of MS patients that are in their relapse period on corticosteroids like prednisone or methylprednisolone. But then you'll also see patients on medications to help with their pain, help with their tremors, help with their cognition or their inability to think straight, their difficulty walking, and specifically and most popular is muscle spasticity. About 85% of patients with MS will have spasticity in their muscles. It is extremely painful, very debilitating, and it requires medications to help with that. Those medicines are usually like muscle relaxers and opiates and anticonvulsant medications.
Okay, and so what is the purpose of those treatments? Does that what does that help do?
The biggest purpose is for symptom relief. I can't stress it enough. MS is a devastating autoimmune disease. It is extremely painful. And for a lot of people that it affects their quality of life. Most patients that have MS want to be active, they have families, they want to be gainfully employed. And so most of the medications are to help with those symptoms. There are also medications that are meant to help prevent relapses or decrease the length of a relapse, also to decrease your frequency of relapses. And then finally, to try to prevent the progression of MS to the most devastating stage.
Okay. And the medications that you mentioned, are these addictive, or do they cause damage with prolonged use?
Unfortunately, yes. A lot of the medications that are meant to prevent relapses, prevent progression, etc., can cause a lot of side effects, and those side effects can range anywhere from just uncomfortable to deadly. Some of those medications can cause a condition that makes you susceptible to a specific type of infection and can cause you to lose your life through infecting your central nervous system.
Wow.
There are also medications for symptom relief. Everyone knows about opiates. Opiates are popularly used for pain flares. Benzodiazepines like Xanax or Ativan are also used for neuropathic pain or spasticity or muscle stiffness. And those medications are controlled substances and highly addictive.
Okay. And so, Dr. Olga, do you believe that cannabis can help manage MS symptoms?
What do you think, Nico?
Well, the science is saying yes, it can.
It's very exciting that not only have our patients taught us as physicians through their self-use of cannabis, they've taught us that cannabis is effective anecdotally, but we're also seeing research that is showing that different cannabinoids like CBD, CBG, CBN, THC, THCA, and especially THC, are extremely effective and proven over and over to be effective. For my patients, I like to start with specific ratios in this case because those cannabinoids are so effective. The ratios are usually THC first, CBD second. Traditionally, it's CBD first and THC second. So I start with a ratio of 1:1 THC to CBD or 2:1 THC to CBD. And that's the ratio, it's not the milligram dosage. I generally like my patients to take the oral mucosal form because it lasts longer and it passes through the liver to allow THC to be metabolized more. But we also educate patients on how to vaporize their rescue because that's extremely important. And we teach them how to smoke the flower because that is also extremely important in our MS patients. These cannabinoids help with symptom relief, but we also believe that they may help with decreasing relapses, decreasing intensity of relapses, and possibly preventing the progression through their activity on the endocannabinoid system.
Wow. Sounds great. So how would a patient speak to their doctor about medical cannabis and if it's a good option for them?
The best way to do it is to just ask. I know that there's a stigma still, but I want to empower you guys. Ask. This is how I learned about cannabis, and so it's really just important to just ask. MS is an increasingly popular disease to treat with cannabis, and so physicians will inevitably be intrigued. Another good way is to Google search multiple sclerosis and cannabis research papers. And then you can find NIH research papers or the equivalent, things like Science Direct Link, those kinds of websites that will give you papers that link or have studied MS and cannabis efficacy. Print those papers up or keep them on your phone, take them to your doctor's office, look smart, keep a straight face, and let them know that you seriously want to consider cannabis as part of your treatment. In the state of Texas, multiple sclerosis and spasticity are both conditions that qualify you for low THC cannabis and medical marijuana with the Texas Compassionate Use Program. So you would qualify just with a diagnosis. It does not matter how intense or how severe your disease is. It doesn't matter your spectrum. All you need is that diagnosis.
Awesome. And so then lastly, what are the steps for the patients to obtain medical cannabis oils in our TCUP program?
Well, that's a great question. So it's still kind of vague what a patient should do. One way is to contact a physician like myself who is registered with the Texas Compassionate Use Program and who is licensed or approved to register you with the Compassionate Use Registry of Texas, which is the CURT system where patients are entered. Your patient information is completely 100% confidential and kept private, so it can still be very discreet. But you contact a physician either by contacting one of the 3 dispensaries directly for their list of physicians, or you can go to the DPS website, which is a little deficient but does have physicians that are active. Then you make an appointment with that physician. After that, you have your appointment, and the physician will verify yourself with your ID and verify your qualifying diagnosis. They will then enter you into the CURT system, and then it takes about 5 to 30 minutes for you to completely be visible in that system. And then the dispensary will have that electronically. So all you need to do is call them after your appointment and after you're registered with CURT, and they will verify your prescription or your recommendation, and then you can order it.
Awesome. Okay, well, that's it. Did you have anything else you would like to add before we sign off?
No, except that be empowered, guys. Cannabis is growing, it's gaining traction. It is a safe drug that is plant-based. Does not have any known or confirmed fatal or dangerous outcomes. It has a very low addictive profile. It is safe to use with most every prescription medication as long as you are monitored by your doctor. So be empowered. This is a real plant-based drug that I want you to consider as part of your MS or other treatments. Please contact me or Nico if you really are very serious, and I'm happy to talk to you guys about walking through the process. But be empowered. This is a safe and effective drug, and it should be considered for your disease process.
No, thank you for that. Yes, absolutely. So thank you so much, Dr. Olga, for joining us on this important conversation and for all you do for our chapter. So I'm going to sign off with you, but until next time, thanks again.
Okay, thanks, guys. Bye.
All right. So I want to thank you again for joining us. We really appreciate you all taking time to listen in on this important conversation about multiple sclerosis and medical cannabis. If you or anyone you know wants to know more about medical cannabis or our programs, please have them reach out to us and we'd be happy to lead them in. Thanks again for joining us, and y'all have a great week.